In part 2 of chapter 5, we are continuing with steps in performing CPR for adults, children, and infants. Remember, this is a brief overview. Obviously, if you are learning CPR and want to be certified, not only do you have to understand these concepts, but you physically have to practice the moves on dummies to, or mannequins, whatever you want to call them, that will help you to get that skill. Remember, practice is important, so knowing how far to compress the chest, understanding how to tilt the head, all of these things take practice. So you're going to have to practice those skills in a physical environment with a leader, in addition to these brief overviews in the chapters. So if we're moving on with adult and child CPR, again, check for responsiveness, activate the EMS. Are they breathing? Observe their chest movement. Provide chest compressions that are hard and fast. Make sure you open the airway. Give 2 rescue breaths. Repeat the compression and breath cycles until an AED arrives. Use the AED as soon as it arrives. Most AEDs have directions on them for placement of the pads, and you will learn that as you're going for certification. Infant CPR, you want to check for responsiveness, activate the EMS, but if you're alone, make sure you give 5 sets of CPR first before you activate EMS and check for breathing. Give chest compressions, open the airway, and give 2 rescue breaths. You need to know how to recognize an airway obstruction. A mild obstruction means there's still air exchange. Forceful coughing efforts might get it out, so you want to encourage people to cough. When there's a severe obstruction, there's no air exchange or very little, so breathing becomes difficulty. A very weak and unproductive cough occurs, or they may be unable to speak or even breathe, or they might be turning blue or have what's called cyanosis. For adult and child choking, ask, are you choking? If the person nods, provide care. Sometimes they use the universal sign of crossing their hands across their throat. That means they're choking. Perform the Heimlich maneuver. Move behind the person, reach around their waist with both arms, and locate the navel. Place the fist with the thumb side down against the person's abdomen just above the navel. Grab the fist with your other hand. Press into the abdomen with quick inward and upward thrusts until the object is removed or the person becomes unresponsive. With infant choking, it's different. You support the infant's head and neck. Lay the infant face down on the forearm and lower your arm to your leg so you have support and you're protecting the baby. Give 5 back blows between the shoulder blades with the heel of the hand. Roll the infant face up. Give 5 chest compressions on the infant's sternum using your 2 fingers, and you're going to repeat this until the object is removed or the infant becomes unresponsive. If a child, adult, or infant becomes unresponsive during the attempt to rescue them from choking, immediately call 911, begin CPR, look for an object in the person's mouth during CPR. So that is the very basic overview of understanding the procedures for CPR. No one would be able to perform CPR on another human being by just listening to this or watching this video or reading these slides. You really need to have that training, and even after training, you have to practice it because we'll forget skills very easily. More practice, the more skill. And with any other type of certification, you have to be recertified, and with CPR, it's every couple of years.